So another thing is cost effectiveness. I know one of our next talks is going to be delving more into that, but I have patients where, I touched on, you start with an antihistamine, you got your eye drop, you got your nose spray, you got your controller and your rescue inhaler. And not just, adults and kids, they look at you and like, you want me to take 5 different meds and remember to take them all and be compliant with them. It's like, good luck. That's hard to do on a daily basis when everyone's busy with their lives. So, this is something that, is important with patients, that certainly with co-pays, with multiple different medications to try to target different systems to try to control them, this can be pretty expensive. And so with immunotherapy, depending on how many vials they get, usually it ranges from like $48 to $96 a month for the vials to order them. And so compared to co-pays for like multiple different medications, there can be a considerable cost difference. So what are the potential side effects with indolent immunotherapy? So you can have local reactions, or you can have a little bit of redness, itching, swelling of the injection site. Systemic reactions are pretty uncommon, but since there's still that possibility, we always want patients during that build-up phase to do the injections in a medical facility. And we want them to wait 30 minutes afterwards, because usually if you have a systemic reaction, it's within that 30-minute mark. And also, they should carry an EpiPen with them to each injection visit, because if they have a reaction, obviously that's very important to have. If they're one of the few people that rarely has a reaction after that 30-minute mark, and you're in the car, for example, that's important to have. So we always stress the importance, make sure you have your EpiPen with you when you get your allergy immunotherapy. So what are some cautions? I recently ran into a patient a couple weeks ago. They're planning hopefully to get pregnant later this year, and she's like, is this something that I can do if I'm pregnant? And the guidelines are that you can continue it in someone who, for example, became pregnant later on, but you should not increase the dose of the immunotherapy, because you just don't want to risk something with the fetus if they have an anaphylactic reaction. But we do not recommend, per guidelines, initiating immunotherapy in a patient who becomes pregnant. So something to think about in your female patients. Again, use of beta blockers. You can potentially block the mechanism of action for epinephrine, so that's something that needs to be cautioned. Again, use of ACE inhibitors. And as Dr. Metz touched on before, is if you've got really poorly controlled asthma, your lung reserve is already a little bit lower, so in case you have a systemic reaction, we don't want patients with really poorly controlled asthma to already start with that. So you want a little bit more reserve in terms of their pulmonary status. And in terms of age, it can be used in kids less than age 5. It really depends on the severity of the disease, the risk-benefit ratio. Generally, with younger kids, there's more caution, because you want them to be able to verbalize or be able to explain if they're having any symptoms or issues, to be able to say that. So that's why in the less than 5 age group, it's kind of a case-by-case basis in evaluating, is this something that would be appropriate for them.